Okay, so someone's had a head knock or a concussion. Do you have a clear understanding of what you should do? 3 early steps are really important: recognize, diagnose, and advise. It's important that anybody can recognize signs of concussion. So if someone's stunned or dazed, if they're motionless, even momentary, confused, balance lost, slow, incoordination, or slurred speech, these are all signs of a concussion. A diagnosis can happen with a doctor or a physiotherapist where objectively they can look at all these things and diagnose it more clearly. And then it's important to get good advice about what to do next. This really important early phase is all about acute management. And what acute management then leads to is some other important steps, which is identifying red flags for medical assessment. That's when it's an emergency and you need to seek medical attention straight away. So for things like if there's neck pain or tenderness, vomiting is another red flag. If someone's experiencing double vision, that would also be a red flag. If you've got an increasing severe headache, we also consider that a red flag to seek medical assessment. People become emotional, they become agitated or quite combative or upset. That's also another sign. If you see a seizure or any kind of convulsion, that's a red flag. Loss of consciousness, which often doesn't occur, but if it does occur, it's a red flag. And then if you have experience any weakness or experience tingling or burning, that's also a sign to seek medical attention. If you don't have red flag, then what you need to do still is to monitor over the next 24 to 48 hours. Because what can happen is you can get delayed red flags of all the things we've just mentioned. So for example, if you're getting increasing headache or increasing dizziness, or you're starting to get more drowsy and losing conscious state, then these are all things to consider. Immediate medical attention is required. Early on, we're becoming more involved with comprehensive assessment, and that's often conducted by a neurological physiotherapist with an interest in concussion. And what we'll look at is a lot of different domains of brain function, like vestibular ocular function, looking at balance and coordination and perception and action tests of processing speed. Neck pain, whiplashes are often common after concussion. We need to assess that. And looking at exercise tolerance testing with specific tests to see how people react and their symptoms with exercise. And that helps us guide things. We're also going to be screening for other things. So we're looking at things like asking questions about vision and sleep and cognitive function, because we're an important part of the referral process to get you to the right health professionals when needed. Return to plans are then well informed by this process. We can help then to advise and to get you back as soon as possible, because we know that influences the better outcomes for people. So returning to school, you consider rest and breaks and the environment and the types of learning involved. Getting back to work or getting back to sport, there may be specific requirements. And all of this comes under the idea of early interventions. And the earlier we do this, the better outcomes for concussion. You can then have, because we're talking about brain function, you can have a number of things like sleep, headache, migraine, vestibular, fatigue, vision. So the number of health professionals can get involved. Mood disturbance, neck pain, neck issues, autonomic dysfunction, coordination, balance, cognition. There's neuropsychologists, psychologists, we've got orthoptists and medical specialists for different issues, physiotherapists and neurological physiotherapists. All these people are an important part of the team to manage persistent symptom management. And this is a really important thing, and it might continue. You might continue with symptomatic management for many weeks or many months in some circumstance. Multidisciplinary brain injury rehabilitation may be required. Thinking about care plans, again, return to plans, and also risk reduction. But what about before you have a concussion? Anything else you can do? We think it's important to be more aware. A greater awareness around concussion now, it has helped. Education about concussion and this complete end-to-end management pathway we think is really important to know what to do. Baseline screening is growing and technology is making that more efficient and logistically possible for us to look at brain function in susceptible groups, like if you're in sporting clubs. And this helps to inform brain function before any concussion might happen and help with the assessments after a concussion event. Risk reduction, so things like bicycle helmet technology, for example, and falls risk reduction, because falls are the most common cause of concussion in the community. All these things are an important part of that process. So this particular area would be about prevention and preparation. So we think that all these 5 areas, prevention and preparation, acute management, early intervention, persistent symptom management, and also ongoing care rehabilitation, are all important phases of concussion management. It's looking at brain health from end to end, and it's a complete management pathway to make sure people are managed more effectively. And it's also these 5 things are probably good areas for different areas of research, progress in our clinical care, and progress in our education around concussion moving further, because the area of concussion management is really, really growing. So if you're working in a sporting club, or you work in a school, if you are working in a healthcare facility or in a business, do you have a clear understanding of your end-to-end concussion management pathway to ensure that these pathways and these directions are clear for the people around you if they experience a concussion? Advanced Neuro Education, so advancedneuroed.com, we have a lot of information, webinars and online courses and information about concussion coming to help you understand how best to manage concussion moving forward. Thanks for listening.